ಬೇಕು ಇದೆಲ್ಲ ಟಿಪ್ ಮೇಲೆ ಹೋಗಿದೆ. Okay, we have to do redo. When you want me to do redo, I can give you good result.
After 2 months, sir, because my exams are coming up.
So what we will do, again, we will be harvesting some rib. I know they have harvested rib for you last time, but I will still be harvesting the rib. May not be so much, just a little bit for doing the work to correct the projection. So what has happened to your nose is that the columella is actually gone inside from the ala and the tip has gone up and the length is less, and on the side you see the nose looks very short for your face. So we have to increase the length of your nose. Okay, so the surgery was done 1 year ago.
1 year ago.
It was much better before.
I had a breathing issue and I had a wide tip here.
Okay. So tip is narrow, but the length has become spoiled. The reason it is not suiting your face. We can. Sure. Girl with us, she had a surgery that didn't go well. Not with us, with another hospital in the same city of Bangalore. And what has happened there? Oh, photo tostira. She's going to show you how she looked before, and I'm going to tell you what has probably gone wrong. And that's her before picture. So you see, she went to the other place and to get this broad nose fixed. Now the broad nose, yes, has been fixed, but what has also been inadvertently done, length of the nose has been reduced. The tip has gone up. So this angle has increased. These are some things you have to understand very clearly, because when you reduce the nose, you got to make sure the length depends on the patient's face. In her case, the length was suiting correctly before. So what I'm going to do in my redo rhinoplasty is not to do anything about the width, because they've done a good job on the width, but they've not done enough work on the tip. The tip has gone up. This tip has to be brought down a clockwise rotation. Length of the nose has to be brought more on. And there's a slight bump here, which I'll correct as well. So this has to come down. It's all pretty hard now. It's broad there. So that's the plan for us. So and this was her before. And you can see that was very broad, yes, reduced, but the tip has gone up. So redo rhinoplasties are one of the most challenging types of nose jobs you can do, simply because you're not only trying to correct the mistakes or the shortfalls of the earlier surgeon, but you also have to remember what the patient's final goal is and what or how the nose was to start with. All of these factors do definitely influence in your treatment plan. I've done hundreds and hundreds and hundreds, literally thousands of redo rhinoplasties over the last decade and a half. And I think the most challenging aspect is to be able to decide what exactly suits for a particular type of a redo nose. There is no rule. Depending on what you see, depending on the scan findings, depending on what the patient's desires are and where the nose was before this journey of nose job was started for the patient, we need to plan precisely. What I've planned for her, I've taken her scans, is that we're going to do open structure rhinoplasty. I'm going to be working on the septum again. We're going to be mainly working on the tip. Not going to work on the alar base because it's pretty narrow already. And most importantly, increase the length of the nose by at least 6 to 7 millimeters. All right, thank you.